Bukidnon State University is a special place for teaching and learning. Its vision is to become a premier institution of innovative and ethical leaders for sustainable development. Its mission: the university shall primarily provide advanced education, higher technological, professional instruction, and training in the fields of education, arts and sciences, public administration, information technology, accountancy, law, and other relevant fields of study. It shall also promote research and extension service and provide progressive leadership in its areas of specialization. BukSU Quality Policy. Bukidnon State University is committed to produce globally competitive and responsible graduates through excellent instruction, responsive research, sustainable extension, and quality production for the highest satisfaction of its stakeholders. Bukidnon State University. Educate, innovate, lead.
This is 104.5
DXBU 104.5.
Paminaw, paglantaw o pakigduyog. Karon atong balikan ang mga igting nga kaagi ug mga daghang nahisgutan dinhi sa programang Share to Heal Season 2 nga adunay napulo ka episodes.
We remain to be normal in spite of the abnormal.
Nini sa pagsugod sa bagong season sa Share to Heal nga adunay mga bagong tema ug mga naglinyang mamumulong nga bisita. Mahisgutan man ang mental health, paingon sa personal growth ug mga mahinungdanong issue sa katilingban, masakop na tanan. Paminaw, pakigduyog ug atangi ang bagong season sa Share to Heal. Maglanog-lanog matag Miyerkules alas 9 hangtod alas 10 sa buntag diri lang sa DXBU 104.5 FM ug Facebook Live. Ang mga nagkalain-laing mga hisgutanan aron kita tanan makaambit sa saktong impormasyon. Kini ang pag-ambitay daw ag kaulian, Share to Heal Season 3.
Mayong buntag mga higala, kamo paminaw sa DXBU 104.5 FM. Mayong buntag sa tanan nga nakatutok sa atuang Facebook Live and YouTube channel. Hello, hello, hello. Good morning sa inyong tanan. Good morning usab sa mga kapaminaw sa tuwa sa ilang panimalay via radio. Welcome sa atong programa nga naghatag kanatog oportunidad nga makapaambit ug makatuon sa nagkalain-lain nga mga hisgutanan. Kini ang pag-ambitay daw og kaulian Season 3. Ghost Blended. Mga higala, kami sa akong partner, malipayon kaayo nga makahatag na usab og bagong hisgutanan nga puno sa kadasig og inspirasyon. Ako si Chaseur, Vann Ontolan, gikan sa College of Arts and Sciences, Language and Letters Department.
Yes, good morning Malaybalay City, Bukidnon, and good morning Bukidnon State University. Happy Wednesday mga higala. Good morning partner Chas.
Yes, welcome good morning partner.
Welcome to episode 14 of our series, Mental Health and the Law, exploring the law and good practices in addressing mental health issues in Region 10. Hello to all our active viewers via Facebook and YouTube and of course, our listeners via radio. Today, we delve into the dynamic world of mental health and legal practices. Let's explore how legal frameworks impact mental well-being and contribute to a more inclusive society. We'll examine the intersection of mental health and law, discussing the positive effects of good practices in our community. Greetings to our smart University President, Dr. Joy M. Mirasol, Vice President for Academic Affairs, Dr. Hazel Jean M. Abiwala, Vice President for Administration and Finance, Mr. Dante S. Victoria Jr., Vice President for Culture, Arts, Sports, and Student Services, Dr. Lincoln V. Tan, and of course, our Vice President for Research Extension and Innovations, Dr. Karina Joan V. Barroso. And of course, partner, di po nato kalimtan na o-greet ang ato mga Level 3 nursing students nga nakaroon sa 4th floor of the research building. Kauban ang pinakagwapa nilang instructor, my good friend, Miss Maris Rochelle Canonigo Sedon.
Yes, good morning.
And of course, no, to all our active or our smart BukSU employees and students, to all our active viewers via online, DXBU 104.5 FM, Facebook, again, YouTube channel, and of course, sa tanan nga naminaw karon sa atong timbahay via radio. Good morning. Maayad haal daw ta inyo alan. This is Lovely Mayhem.
Yes, partner. And partner, we would like to greet those who are watching us via Facebook Live. Rupert Juarez Albaracin, hello, good morning. Dr. Jimalin Paulican, partner. Sige gapon siya tanaw, partner, no? Naira Handugan, Marie Sidon, Leonard Naparan, good morning sa inyo tanan. Daghan kayo taog mga nag-greet din na sa tong comment section. Well, post your greetings mga higala kay later on magbasa pa mi ni Lovely sa inyong mga greetings.
Yes.
Mga higala, kini ang programang Pag-ambitay daw ag kaulian, Share to Heal Season 3 goes blended. Partner,
Sa pag-ambitay o paghiusa, kalambuan makabuta.
Ang Pag-ambitay daw og kaulian, Share to Heal Season 3 goes blended is a university-wide extension program sa Bukidnon State University. Uban sa lokal nga pangagamhanan sa syudad sa Malaybalay sa pagpangulo sa atong pinalanggang Mayor Honorable Attorney J. Warren R. Pabiliaran ug 2nd Congressional District of Bukidnon sa pagpanguna ni Honorable Attorney Jonathan Keith T. Flores. Kini nga proyekto gipanguluhan sa atong Smart University President Dr. Joy M. Mirasol nga siya usab ang program leader. Kauban usab nato atong project leader ug ang Vice President for Research Extension and Innovations sa BukSU nga si Dr. Karina Joan V. Barroso nga naa sa pikas karon, partner.
Yes.
No, active kayo ang ato ang VP for Research gyud. Ug ang atong Extension Director nga si Dr. Jimalin B. Paulican nga kanunay ga-monitor sa tuwa via Facebook Live.
Yes, so pinaagi sa DXBU 104.5 FM, the educational and community-based radio station of Bukidnon State University, inyong makita ug mapaminawan ang atong live stream via Facebook and YouTube channel. Don't forget to follow, like, and subscribe mga higala. Kini nga programa inyong madunggan matag Miyerkules alas 9 hangtod alas 10 sa buntag. Atong batasanon ang pagpaminaw ni ining programa nga gatod kanato sa mga impormasyon alayon sa lahi nga dimensyon sa proyekto.
Last episode aton hisgutan ang From Recovery to Sustainability, Transformative Education in the New Normal. Kauban si Dr. Edison A. Fermin, Chair sa CHED Technical Panel for Teacher Education and the Vice President for Administration and Finance, Vice President for Academic Affairs sa National Teachers College. O kini ang mga highlights sa episode 13.
Paminaw, paglantaw o pakigduyog. Nasayran nato sa miaging episode sa Share to Heal Season 3 ang hisgutanan bahin sa
From Recovery to Sustainability, Transformative Education in the New Normal. Sa atong miaging Share to Heal Episode 13, atong nadunggan ug nasinati ang mga kahulugan sa Transformative Education. Matud pa ni Dr. Fermin na kaning Share to Heal ang usa sa mga pamatuod nagasubay na kita sa Transformative Education. Iya usab gisaysay na ang organisasyon nga sama niini nagtukod og transformative nga edukasyon aron maghatag og kahigayunan sa mga mag-estudyante nga mahimong dasig og makahanay pinaagi sa pagkamalipayon og himsog. Kini makatabang sa ilang mga desisyon aron molambo sila sa ilang kaugmaon isip mga katawhan sa nasod o sa tibuok kalibutan. Matud pa ni Dr. Fermin na usa na tumakabo ng sustainable development in education is through transformative education. Busa, dapat makaingon ang mga estudyante na adunay na bag-o sa ilang kinabuhi sa maayong pamaagi.
Paminaw, pakigduyog ug atangi ang bagong season sa Share to Heal maglanog-lanog matag Miyerkules alas 9 hangtod alas 10 sa buntag. Diri lamang sa DXBU 104.5 FM. ug Facebook Live ang mga nagkalain-lain nga hisgutanan aron kita tanan makaambit sa saktong impormasyon. Kini ang Pag-ambitay daw ag kaulian, Share to Heal Season 3.
Wow, what a very timely topic that was, partner Chas, no? I'm very sure gid nga daghan gid kay natun-an ang atong mga tigpaminaw ato, partner, especially sa mga panginahanglanon o panginahanglanon sa pagbago o pag-adapt sa education aron magpabiling effective and relevant. Kini nagpakita sa kamay ng danon sa pag-integrate sa mga estratehiya nga nag-focus sa kalig-on, adaptability o equity o sa pagtagad sa holistic development sa mga estudyante, ilabi na sa ilang emotional o social nga kaayuhan. Karong partner no, atong paminawon ang mensahe gikan sa atong Vice President for Administration and Finance, Mr. Dante S. Victoria Jr.
Ladies and gentlemen, today we are excited to launch the third season of our university's extension program, Pag-ambitay daw ag kaulian. Over the past 2 seasons, this initiative has transcended boundaries, brought communities closer, and made a profound impact on lives. Pag-ambitay daw ag kaulian embodies the essence of empathy, collaboration, and the transformative power of knowledge. It's about extending a helping hand to those in need, whether through education, healthcare, or community support. In this upcoming season, our commitment to creating positive change remains unwavering. We will continue to foster connections between students, faculty, and the wider community, amplifying our collective efforts to make the world a better place. Pag-ambitay daw ag kaulian is not just about what happens within these walls. It's about what we take beyond them. It's about inspiring a ripple effect of compassion and understanding that extends far beyond the campus boundaries. As we embark on this journey together, I encourage each of you to embrace the spirit of Pag-ambitay daw ag kaulian. Let's empower one another, uplift our communities, and work towards a future where healing, compassion, and collaboration are the cornerstones of our society. Thank you for your unwavering support, and I look forward to witnessing the incredible impact that we will create in this third season of Pag-ambitay daw ag kaulian. Together, we can make a difference that lasts a lifetime.
Mga higala, atong nabati si Mr. Dantes Victoria Jr., atong Vice President for Administration and Finance. Daghang salamat, sir, sa imong makanunayong pagsuporta sa programa ug daghang salamat sa imong heartfelt message. Mga higala, excited ako sa bagong nga topic nga atong nga usab pagahisgutan karong adlaw. Ug it is my pleasure to introduce to you all of you atong guest nga usa ka nurse sa Department of Health Regional Office 10. Siya usab isa ka key contributor to mental health education and practice, enhancing the field's development. She engages in organizing and presenting at major nursing conferences, demonstrating a commitment to ongoing education and research. Mga higala, atong bisita si Miss Maria Dolores D. Mercado nga magpaambit sa ato mahitungod sa mental health and the law, exploring the law and good practices in addressing mental health issues in Region 10.
Yes, so partner, no, we're not just here to talk, but to share, learn, and heal together. Mga higala, you can join the conversation too just by using our official hashtag #ShareToHealGoesBlended on all social media platforms. Good morning, Ma'am Dolores. Welcome to our program Pag-ambitay daw ag kaulian, Share to Heal Season 3 Goes Blended. We're so happy that you're with us today para atong maisgutan ang mahinungdanon nga topic karong buntaga. So, ma'am, before ta magsugod sa atong hisgutanan, basta na ka gusto i-greet and i-shout out sa kanginan, ma'am, no? Especially sa tanan mga nakatutok sa imo karon sa Facebook Live and of course sa atong YouTube viewers and listeners via radio. Good morning, ma'am.
Hello, ma'am. Maybe or you're on mute, ma'am.
My mic is already on.
Ayun, yes. We can hear you now, ma'am.
Okay, so good morning. I am here at the DOH because I cannot travel. Well, greetings to all who are listening and greetings po sa mga maestra sa BSU. I have known some of them, mga CI sa nursing sa BSU. I do not know if napaba sila, but we are here to talk about mental health and the law, so we will discuss more as we go on. Thank you.
Yes, thank you so much, ma'am. Ma'am, how are you today, ma'am?
Actually, I'm okay. I'm feeling better because I have done my daily exercise.
Wow.
I walk in the boulevard every morning. So from 4 o'clock in the morning to 6 o'clock in the 4:30 to 6 o'clock in the morning.
Wow. Oh, kita partner.
Ay, you work out every day.
Warag wala ako naka-jogging ka rin.
You work out every day after work.
After work later.
Yes.
Yes, ma'am. Thank you so much for that, ma'am. No, importante gud nga natay workout every morning, no? Or every day. Ma'am, before I give my first question, ma'am, regarding the law in the Philippines, ma'am. Ma'am, can you give us a status, ma'am, or what is the current status or unsa ang scenario nato sa Region 10 when it comes to mental health issues? Dako ba kayo ang ato ang problema sa mental health diri sa region?
Actually, if we are going to base from reports sa health, we have already plenty of cases with mental disorders, but generally we have psychosis. Mostly our patients, as per reported from our local government units, because we generate reports from our LGUs and we tabulate the reports for the provision of medications for the patient. So generally, most of our patients have psychosis. With regards to the mortality of mental disorders, we have only suicide. And suicide has not been reported well in the past 4 years because of the way we report it into the health sector, because the doctors will submit the report according to what are the cause of death. Exactly. So most of our cause of death would be hanging, strangulation, but we cannot report that as suicide because there could be other reason why the patient dies because of strangulation. It could be that the person was strangulated by somebody else. So we only report those submitted as suicide. That is why we have low cases of suicide. However, in the present year, last year, 2023, we already have an increased case of suicide in the region. It goes up because the reporting has already included strangulation, suicide, or hanging, suicide. Unlike before that they will only write hanging or strangulation or poisoning. But now they report it as strangulation, suicide, hanging, suicide. So our case in our data is already increasing. Although in reality, there is really increased case of suicide. However, it is not reported well. It's because of that factor. The way we report it is that we report the cause of death, but we do not include suicide in the cause of death. It's secondary, so it will not appear in our system. We will only see the cause of death. So, but in 2023, we have sudden increase of cases of suicide. However, for our disorders, we have high case of psychosis only, Depression, anxiety is lesser, but we have more case of drug abuse or substance use disorder, and the child developmental disorders. Those are the cases that we have in the region.
Thank you so much for that, ma'am. Based on our previous conversation, ma'am, or the last question that I have thrown, ma'am, we can somehow attribute suicide to mental health conditions. Now, basing on that, ma'am, do we have policies or laws in the Philippines that are in place to ensure that our well-being or mental health well-being is protected?
Actually, yes, we already have the law. In 2018, it was signed by President Duterte, the Mental Health Act of the Philippines, the Republic Act 11036, which we are using now. No, we are into the implementation. We started the implementation in 2019 because the IRR was signed by that time. However, the implementation was not really in full blast because we met the pandemic. No, we were not able to even cascade the law to the public. However, we have started implementing some of the provision of the law. But the law doesn't only require the Department of Health to implement mental health, but it involves everybody. You know, all the stakeholders are there in the law. They have their own roles and responsibilities, and there is a strategic plan, which or a strategic framework created by the Philippine Council for Mental Health, because the law says that there should be a council for mental health who will be the one who oversees the implementation of the law. There was a strategic plan from 2019 until 2023, and now we already have a new strategic plan for 5 years, another 5 years, 2024 to 2028. We have already evaluated the strategic plan for 2019 to 2023. Some of those in the strategic plan from the previous 5 years are included still, no, in the 2024 strategic plan. And for the workplace, since it's part of the law that there should be a guideline, or there should be a mandate for mental health in the workplace, or government agencies, the civil service has already created the mental health in the workplace policy, and the DOLE creates for the private establishment and agencies.
Yes, thank you so much for that, ma'am. Before I proceed to my next question, ma'am, no, you have mentioned a while ago, ma'am, that we already have laws in place, ma'am, and that the Civil Service Commission was the responsible party to craft the policies on mental health. Ma'am, can you give us an overview of what are the workplace policies that that talks about mental health, ma'am? For those listeners nato, ma'am, nga wala nakabasa sa katong law, ma'am, or wala naka-read sa civil service policy, ma'am.
Okay, actually, the civil service policy is created to emphasize, no, that there is a mental health law that should be implemented in the workplace. Like each institution should create their own mental health policy, provided that they will implement the well-being of it. It goes into the well-being of the workers, no, the employees of the workplace, and not violating the human rights of the people in the workplace. And another one that should be included is, even if our worker has mental health problem or they have been diagnosed with mental disorders, as long as they are treated and they are working, they should not be discriminated, and they should still work as an individual, and limit the discrimination and stigma among our workers who are having mental disorder, because they can still go back to work, and they can also work as a normal individual after they are treated, no? So the workplace should have that policy. The policy is dependent on how it should be based on what type of agency you are, no? But there are guidelines as to what are the things that should be included in that policy. So each institution must have the mental health in the workplace. Supposed to be the civil service is the one who should monitor if all our government agencies are already implementing the mental health in the workplace, because it's a memorandum circular from the civil service. So each institution, government institution, should abide with that memorandum circular. So it should be according to what you are doing in the workplace. But basic thing there is there should be welfare activity for the workplace. Another one is respect the rights of the employees who are having mental disorder, and there should also be management in case your workplace or your employees have mental health problems. So the human resource development should be responsible for the welfare of the employees. So they are the one to monitor and implement the mental health in the workplace.
Yes, thank you so much for that, ma'am. Thank you for clearing that out, ma'am. No? Ma'am, can overworking, often seen as dedication to work, be considered one of the primary contributors to mental health issues, particularly in the context of the Filipino work culture rather? So we are talking about overworking na here, ma'am, no? Medyo dako ang term ng overwork. So maybe we can break it down siguro, ma'am.
Actually, even if you are overworked, as long as the individual's coping mechanism is very good and the support system is also very good, there's no problem with your mental health. So it's the individual's coping is more important compared to how you give work to the person, or the person is given so much work. But basically it also adds to the stressor, no? Because if you are overworked, you will also experience so much stress. And you know, stress is the most common reason why a person develops mental disorder or any other disorder, because your body may not be able to tolerate the stressful event, how much more your emotions, no? And but if the person has a very good foundation, no, since growth and development, it still boils back to how you were brought up as a person.
Yes.
That matters a lot, no? It does not anymore matter kung if you are working hard, or as long as you have a good coping mechanism and you have a good support system. That is why in the workplace policy, you should include that one, no? That there should be support for the mental health of the employees. Since overwork can cause too much stress to the person, and they will be able to go into the burnout stage where they will not be productive anymore. So the workplace should also involve stress management activities for the employees.
Yes. Thank you so much for that, ma'am. Actually, ma'am, no, with your answer karon, na-answer ni mo ako ang supposedly next question, which was to talk about work culture and workplace. No? So, importante giday kaayo nga we have to create a culture that actually addresses our stressors. No? Kay mo na siya ang reason, or that's the only thing makakope ta. The only way makakope ta. Ma'am, my last question before I turn you over to my partner here. What is the role of the Department of Health, ma'am, in ensuring the workplaces are checked, especially in promotion of mental health?
Actually, our health promotion unit is working on the institution, healthy institution. No? So they are promoting all the health programs in the healthy institution, but mental health is part of that one, no? So we are doing advocacy activity on how you maintain a healthy institution. It doesn't only talk about mental health, but it also talk the physical health, because you know there is such thing as the mental and physical health is interwoven, meaning if you are sick physically, your mental health is also affected. If your mental health is having a problem, basically your body will also react to it. It's just like when you are having headaches, backaches, it is said to be a sign of having depression or having anxiety. No? So these are the what they call as the blind symptoms, where people does not really bother because they're just ordinary pains that they feel and the headache that they usually feel. But oftentimes these are already signs of depression, because most of the time, no, people who have depression will have physical reaction instead of emotional reaction.
Yes, that is true, good. I agree with that, ma'am, no, because partner, just ano lang, no, I have a friend, no, recently lang, he chatted me, siya, maglisod siya mata. It feels like he's dragging himself up to work every morning, kay murag, wala siya gana mag-work, yung and then he feels sad, he feels lonely every morning, pero every morning rapod. Later part of the day, okay na siya. Pero pagka next morning, mubalik na sa to siya nga feeling. Probably this is one of the telltale sign, no, of an issue, no. Small pa siyang issue, pero pag mapasagdan, probably later on mudako siya. To further discuss that, ma'am, I will now give you to my partner here, ma'am.
Yes, thank you so much, partner. Good morning once again, Ma'am Dolores. So, Ma'am, for Region 10, Ma'am, now what age group and gender are most prone to mental health issues, Ma'am?
Actually, in our data, we did not very specifically gather the ages, but when you are going to look into the disorders, we have so many cases of psychosis, and mostly are adults. And we also have high number of cases for the developmental disorders, which are for children, though it does not match the number of persons with psychosis in the region. No? And for the gender, we gather only the gender for suicide, and it is not really alarming, no, because it's a worldwide data where male has a higher number of suicide compared to female. It's male is 4 times commit suicide more than female, while the female has a high number in the attempted to commit suicide. It's actually it's a nature of a human being. No, men does not talk, while women talks about it. That is why we have so many completed suicide among men compared to women. So we should encourage men to talk about their problems, because if you don't talk about it, then you will suddenly see them doing the suicide. While women will tell their stories of committing suicide. So we will be able to prevent suicide if we ask what are their plans. Number one issue now, the suicide. We have so many call up from the LG, you know, to train them how to handle patients who are suicidal. So we are bombarded with requests for training on how to assist this. We have common age for suicide that we have in the region are the adolescents. No? So we have lesser number of older people, because in the general information, there are more older persons, more than 65 years old, who commit suicide. But in our region, we have more ages of the adolescents up to the early adult age. But for older persons, we have less number of cases for older persons. So that's our number one issue now. So we are going to do some activities so that or the LGU has already initiated their activities with regards to suicide prevention, because before it's not an issue to them, no, when about mental health, but when suicide became alarming in their area, they started to look into what is going on. Why is it that we have so many students who commit suicide, not only at home but even in school? No, students commit suicide. So there are LGUs that even the mayors are the one who really initiates their suicide prevention activity.
Alright, ma'am. So, ganina, ma'am, no, kainyo namang naisgutan ni partner Chas ang telltale signs, no, of mental health issues. So, ma'am, are panic and anxiety attacks considered to be mental health issues, or are these symptoms of a bigger mental health issues?
Okay, when you're going to say panic attack, these are anxiety symptoms, no? Because we have anxiety disorders. It could be panic anxiety or any other type of anxiety disorder. There are so many types of anxiety disorders, but in the world data, anxiety is next to depression. But in our region, we cannot see this as a data because oftentimes people will not go to the doctor if they are experiencing anxiety. But you can see anxiety in the emergency room, like people who have difficulty of breathing, no? And people with having chest pain. Those are actually, some of these patients are not manifesting physical problem, but they are really having anxiety problem, no? So if they will be diagnosed, then they will be managed properly, and the anxiety may disappear for a while. However, it will recur if they will have another stressor, no? So there are triggering factors that would make the person experience again the anxiety attacks. But there is anxiety disorder, and there are also depression. These are disorders under mental health, no? So we have different mental health disorders, but in the world, the number one disorder that we have is depression. Second to that is anxiety disorder, no? Psychosis is only 1%, 1% only in the world. And even in the Philippines, that is still the same issue, 1%. And but depression is 3.3%, no, in the world. That's very high already. That is why we have so many cases of suicide, because most of those who commit suicide have bouts of depression. Only that in the Philippines, we are not in the Philippines, because in the Philippines our data is still 3.3% for depression. But in our region, we do not have that data. 3.3. We have very low case of depression and anxiety because our people doesn't go to the doctor if they are experiencing depression or anxiety. Usually they go to the emergency room, and you can see those people with anxiety in the ER. Not really that they are having physical problem, but they are having mental health issues.
All right, thank you so much, ma'am. So, ma'am, why is it so hard for those people with mental health issues to confide with others? No, so unsa ilahang gibati na murag or unsa ilahang gaagian, murag lisod gid kay sa ila isulti sa ubang tao.
Actually, it's not that it's very hard for them to tell. It depends on the person also. But what is lacking is the support person. To whom are they going to tell? Are there people who will listen to them? Or if they're going to tell their story, will this person she's going to tell her story will not judge her or will not say anything that is not good to listen at? But because supposed to be, if we are going to start with mental health issues, we should start from ourselves. We should look into our issue on, if we see somebody who is sitting down at the corner of the street and the person is very dirty, what are you going to do? What you usually do is you are going to deviate your route and stay away from the person. what is the reason why you deviated and you stay away from the person? It's because you are afraid, no, that the person will harm you or whatever that person will do. In that attitude alone, that is already a bad attitude towards mental health. Why? Because number one, there is, why are you afraid? You judge the person. So you start from yourself. No, we start from ourselves. We should not be judgmental towards other people, especially if we do not know them. And secondly, we should also offer our ears, because we were given 2 ears because we need to listen more rather than talk. So if we are supposed to talk a lot, we are supposed to be given 2 mouths and 1 ear. No, so we should start from ourselves, because people cannot tell their stories because they're afraid to be judged. And aside from being judged, there will be stigma and discrimination to that. But you know, we can end stigma and discrimination from ourselves. We started from ourselves by not being judgmental and just offering our ears while listening to those people who are sharing their stories. Not necessarily that we give advice or tell them anything, but listening alone can already help a lot. No? So let these people who have mental health issues feel that there is somebody whom they can tell their stories.
All right, ma'am. So, ma'am, who should be involved in the promotion of mental health welfare and the implementation of mental health practices in our society, ma'am?
Actually, it's if we look at the law, there are so many agencies involved there. No? We have DILG. For the education sector, there is DepEd, SHED, and TESDA. No? So they have their own responsibilities as to how they're going to keep the well-being of the students, no, including the faculty. But the faculty falls under the civil service, and because they're employees. But for SHED, TESDA, and DepEd, they're responsible for the welfare or the mental health of the students, while the civil service is responsible for the welfare and mental health of the employees in the government sector, while the DOLE is responsible for the employees of the private sectors, no? And then even the of course the Commission on Human Rights are number one there, no? Because the law says we have to protect the rights of the persons with mental disorder. But the law says these people are called service users. No, we do not call them mentally ill, but they are called service users, or SU. For psychiatrists, usually they call them persons with lived experience, or PLE. But the law states SU, service users. No, so we have so many stories actually of the people who have recovered from mental disorder, no? And DOH has already provided free medications. We have already trained our doctors in the health centers, no, to diagnose and manage patients with mental disorders. In Malaybalay City, one of the doctors there was mentored and coached by the psychiatrists of NCMH, and they actually appreciated her, no, because she's the doctor, among the doctors that we visited, she diagnosed depression, and which we cannot see much in the other RHUs. Pero sa Malaybalay, one of the doctors trained with MHGAP diagnosed depression, and she really sees the patient herself, no? So with that, you can actually go there. If you're from Malaybalay, you can visit if you have problems, no? But the PHO of Bukidnon has a psychosocial team. They also handles people who have problems with mental health, because they have psychometricians there in the PHO. However, they have also referral system. No? So you can visit there in case there are problems. But I think in yung school, you have also your own guidance counselors and those psychologists, no, and the like. Even the nurses can also listen, but you do not need to become a health professional to listen to a person who have problems with mental health.
Alright. So, partner, before tama ato sa ato ang sunod nga segment, partner, no? Ganina kainyo namang yung dimension ang mga first telltale, no? Sa telltale signs sa ato ang mental health issues. So, mabasa na pa kay dugang kang kana betong gina-take for granted na nato nga, muna madagini siya, isa na magini siya sa mga signs nga naagi din siya mental health issues. Kaya di ba, nabe usahay pareha sa gimension ni ma'am ganina nga, ato rin gina-take for granted kanay mga sakit-sakit sa tong ulo, no? Nga mga signs. Other than that, ma'am, katong gimension ni partner Chas and katong imong ipang mention earlier, unsa pag mga telltale signs nga naay mental health issue ang isa ka tao?
Actually, because we have very high cases of suicide, no, we have to focus more on the depression issue of an adolescent. So, sometimes we neglect to see that this adolescent will suddenly stay at home. They will stay inside the room, and it seems that they are just inside the room and they are lazy. But actually, they are already experiencing the bouts of depression. So parents should look into that, no, because maybe that is another thing that we miss to see, why we have so many cases of adolescents committing suicide, because they are actually experiencing depression, but we just look at it as being lazy, or they are very good children because they do not go out from the house, no? Buutan nga mga bata kay nara sa balay di gagawas, but actually they are experiencing those bouts of depression, and then suddenly they will commit suicide, and then we will say that nagbulag sa uyab, nagbulag yang mama o papa, and all those things, nabagsak sa klase, and all those things. But basically, it does not really go in that manner, no? The depression does not start just suddenly, but it has been there. It has been there for a long period of time, no? But it will be triggered by a very strong stressor, like separation or death of loved ones, but and of course failure, no, can be a triggering factor. But the depression does not appear suddenly. It's not, because mental health issue is not like a virus that there is an incubation period, no. Usually when you say mental disorder, it usually starts when the mother got pregnant. And how did the mother take care of the child as the child grows up? Aside from the environmental exposure of the child. So, that covers the coping mechanism of the person. How strong is your coping mechanism? It does not happen now, but it happened long time ago. So, we have to take care. For parents, no, they have to look into the first 2 years of life of the child, because there is a research study that shows that most of those people who have a bad behavior or a social problem in the future are those who have traumatic first 2 years of life. That's the development of trust and autonomy. When you do not develop that as a person, basically you will have a problem when you grow older. You do not know how to trust. At the same time, you do not know how to decide on your own. These are the behavior that is gone for patients who have mental disorders. Morning mawala sila, they do not have the ability to decide, and they do not have the ability to trust people. That started in the first 2 years of life. That is why in other countries, they have this 2 years maternity leave or 1 year maternity leave. The mom has to take care of the child, because if other people takes care of the child, you do not know what was done to that child in the first 2 years of life. And in the Philippines, we cannot provide 2 years maternity leave. We cannot afford. We are not a rich country. So what we have in our law is in every establishment, there should be a breastfeeding room or area and a toddler area, no, for mother, or a play area for mothers who are working, because they cannot have a maternity leave for 2 years. We only have 120 days, I think, maternity leave, no, but we can actually do that by having a breastfeeding room, so the mother can bring her 0 to 1 year old child in the workplace, but stays in the breastfeeding area. When time for breastfeeding, the mother will go there. And for the 2 years old going to toddler, if the office can provide a place for children of that age, then they will also bring, no, the children, and they can see their child while they are working. But of course, it's not that they will take care of their child at the office, but they will have time to look into their children while they are working. And that should be a provision, because that is also, there is also a law for that, no? But if we look into the establishment and the agencies that we're working, I do not know if you have that one in your workplace, no? But that should be one. That is also for mental health. It's not just that it is because of having a child, but you take care of our children well, then we will have a better mental health in the future.
All right, so very clear, partner, no?
Yes, very comprehensive
Thank
kayo
you so
answer
much,
ni Ma'am Dolores.
Klarong-klaro gid kayo, no?
Yes. Ma'am and partner, gabi ka mahinungdano nga atong topic karong buntaga, and I know daghan pa sad gyud gusto mangutana sa atong bisita karong buntaga. Ang atong sunod nga segment, mga higala, mao ang Share to Care. Kini usa ka espesyal nga bahin sa atong programa kung diin ang mga estudyante adunay higayon nga makapangutana ka bahin sa atong topic karong adlaw. So ma'am, natay mga estudyante nga mangutana sa imuha, ma'am.
Yes, oh, you're right, partner, no? O para sa atong Share to Care, atong makauban sa Pikas Lawak, no? Ang partner nga mag-interview sa atong mga students diri sa BukSU para makahatag sila og higayon nga makapangutana sa atong bisita karong buntaga. Atong kauban partner, Maria Angelica Mugot, please come in.
Mayong buntag mga suking tigpaminaw ug manananaw sa pag-ambitay daw ag kaulian Share to Heal Season 3. Aniya kita karon sa BukSU Annex A campus ug kita mangutana sa atong mga estudyante under the College of Education kibahin sa atong episode 14, Mental Health and the Law. Aniya karon si Ms. Sofia Akin Parista, a Bachelor of Early Childhood Education student sa iyahang pangutana.
Good morning. So I am Sofia Kimperista from Bachelor of Early Childhood Education, and with the expansive reach of mental health awareness campaign in the Philippines and in the region, there remains a notable necessity to establish a secure environment to address such concerns. So the question is, how can we make a community that is more driven by policies to establish or to enhance mental health awareness?
All right.
Okay. So, actually, our mental health awareness has just started. No, we have just started last 2 years ago, but because of the pandemic, we were not able to have it extensive. Last year, we have already started the extensive health awareness campaign all over the Philippines and also in the region with the help of our health promotion unit. But in the our health promotion unit is the one who goes down to the community, and we also have training of the barangay health workers regarding mental health. No? So we train them to identify people who have problems with mental health. So our policy actually does not involve only the health sector, but everybody, each and every one of us has the responsibility to provide mental health awareness. When you are in school, you're a teacher, you have to provide mental health awareness among your students. And if you are a worker in health, basically you will go to the community and provide mental health awareness among people. But sad to say, sad to note that if we are going to expect that we will have a good mental health services in the Philippines, when I went to another country, I was able to experience a very good mental health service. No? So I asked them if I told them that in the Philippines we have just started with our policy and law, and they told us it took us 30 years to be like this. No? So we just have to start with mental health awareness in as much as we can, so that we will reach the point that mental health is not anymore a problem that can cause stigma and discrimination among people. And people with mental disorder or people with mental health issues will not be afraid anymore to go for help and ask for treatment. No? But that would still take us a long period of time, but we have to start now, or else we will not reach that goal, where stigma and discrimination is not anymore an issue. Like, people with mental disorder will just sit beside you while you are riding the bus or you are riding the jeepney, and it's just like you are sitting with an ordinary person. That's our goal actually with our mental health. But we will start from the community.
Alright, thank you so much, ma'am. Ato na pong balikan karon atong partner Maria Angel Mogot, kauban ang estudyante nga maghatag sa iyang pangutana.
Ug aniya kita karon sa atong ikaduhang pangutana nga magikan kang Mr. Kent John Benemerito from the Bachelor of Secondary Education, major in Science.
Good day, everyone. I am Kent John. So my question is, given the tangible movement towards the prioritization of mental health, how can we move beyond the awareness phase and transition into implementing policies and best practices to address mental health issues?
Actually, we are already into the implementation. No? We are going all together from awareness to implementation of the mental health services. We have already created packages for we have already created PhilHealth packages for mental health, because there is none. Now there is already a package for persons who are having mental disorder and they are into treatment. So, because medication is very expensive for patients, and it would cost a lot. But DOH is providing free medications to the rural health units or your city health office, as long as they provide us the list of patients and the medications that they need. We provide them. However, we do not provide them 100% because it's in the law that the LGU should also procure their own medication. No? That's in the local government code. So we just provide, I think it's 60-40 supposed to be, but most of the time we provide many medications just to let the people experience that they can be managed, and they can be managed even if they do not have enough money to buy for the medication. It's given for free. Some of the LGUs are also procuring their own medication. So we are not just into mental awareness, but we are already into managing patients with mental disorder in the community. We do not encourage any more treatment going to the hospital, because we do not have one here in our region. We have to go to other regions just to be admitted as a patient. And we are moving into training our doctors in the hospital, secondary hospitals, to accept patients with acute conditions, no, katong mga hyperactive patients or combative patients, if the RHU cannot manage them because they really need to be admitted, then we will go to the hospital, and we will encourage hospitals to have at least 2 bed for acute cases, no, and we will be training the doctors with emergency cases of psychiatric condition in the hospital. But we have started first with the RHUs, ang mga health centers, because we have so many patients who cannot go to psychiatrists and cannot travel from Cagayan to Davao because we can only see hospital in Davao for here in Mindanao. No, Davao will have one hospital and Zamboanga, but Zamboanga is already very far from us. Davao is the nearest hospital we have. So we trained our doctors to diagnose patients with mental disorder and manage. So that is not anymore a policy, but we are also encouraging the LGUs to develop their own policy so that there will be no problems with our problem is that people will the patient is ping-ponged by the police, the social worker, the health worker. They do not understand each other, who is responsible for the patient. So that is a problem before, but now they have already created their protocols as to who will handle the patients and where does the patient go. But our goal now is the community mental health center, no? So there is also management just at home, no? You can actually manage patient at home. They do not need to go far away to be admitted in the hospital. So it's beyond policy, no? We are already into implementation. Aside from providing medications and providing health services, that is already implemented in most of the LGUs. However, there are still doctors we need to follow through and mentor and coach, no, because even if they are doctors, they are not specialists. They're also not confident not to handle patients with mental disorder. If you are not used to it, you will be afraid of handling patients, especially combative patients. But we will try to mentor and coach our doctors so that eventually they will not be afraid anymore of the patient.
Yes, daghang salamat Ma'am Dolores, no? And daghang salamat sa itong mga estudyante nga grabe ka-active sa pag-participate and sa atong partner sa Pikas Lawak, Miss Maria Angelica Mugot. Once again, Ma'am Dolores, daghang salamat. Ma'am, I know, ma'am, nga daghan pa tayong hisgutanan, ma'am, no? Pero wala na gyud tay igong oras para magpadayon sa ato ang pagtuki-tuki. As much as we want to keep you longer and talk more about the topic, ma'am, wala na lang diri na lang gyud ta kutob for now, no? For now. Napa ba kay parting message ato mga tigpaminaw karon, ma'am, sa atong mga listeners via radio, Facebook Live, and YouTube channel?
Okay, so I will just emphasize that mental health issue doesn't only involve one agency, but it involves all the agencies in our society. Not only government or private, but we also involve the civil society organizations and the other non-government organizations for that. Mental health is an issue that is not concerning one, but it concerns everybody. And we can also start our mental health awareness. We start from ourselves. Be aware of your mental health. Do you know if you are mentally healthy? Or did you ask yourself that question, if you are mentally healthy? If you believe that you are not, or there is a problem with your mental health, ask someone. Go to somebody and talk to someone. You do not need to go to a health worker or a professional for that matter, but one thing that for sure is that if you talk or you share your thoughts and your feelings to someone, your stress or the feelings that you have placed inside you will disappear. Kanang inyong mga headache, backache will be gone if you are having good mental health. maybe you're taking medications out, over-the-counter medications for headaches, backaches, but it still come back. Then think about it. That might not be a physical problem, but that might be a mental health problem or a mental health issue. So we just have to take care of our mental health, no? So that we will have lesser problems in the future, lesser patients, because, you know, it costs a lot to have a mental disability. It will cost a lot. You will pay a lot for that. So mental disorders can be prevented. You just have to speak to me. That is what we promote in the Department of Health. Now, we have the 12S ng DOH, 12 stress management. Speak to me and then talk to someone. Another one there is you smile, no, because smiling helps to increase your endorphin and enkephalin, and pain in your body will disappear. That's actually a hormone in the body that makes you feel better. And another one is if somebody's there, no, and if you go to the office, you greet your office mates and tell them, "Kumusta ka?" No, you ask them, because by asking that, you can actually help a person who is thinking of committing suicide. No, you did not know that that person was thinking of committing suicide, but when you say "Kumusta ka," then he has the channel to express her emotions by telling that very simple greeting of "Kumusta ka." Helps a lot. No, it helps the person to express himself or herself. No, especially ang mga lalaki at kumusta ng mga lalaki, because of the patriarchal concept that men is not a man if they talk a lot. No, only women talks a lot. But when there is a problem, let us encourage our men to tell their stories, because that's the most common reason why we have very high cases of suicide among men. So take care of your mental health, because mental disorder is preventable as long as you take care of yourselves. Thank you.
All right. So yes, no, thank you so much once again, Ma'am Dolores D. Mercado. And yes, no, thank you so much, ma'am, for answering all of our questions, ma'am. Indeed, it was very, very insightful. Daghang gid kay minatunan, ma'am. Thank you so much. And now, for a moment of inspiration and creativity, we believe in celebrating the creativity and resilience of our students. Get ready to be amazed in our next segment of Share to Inspire. So yes, mga higala, no, this talented student will serenade us with her rendition of Adele's Chasing Pavements, one of my favorite songs, partner Chas, no? Let us hear from Princess Hannah Garcia.
I've made up my mind, don't need to think it over. If I'm wrong, I'm right. Don't need to look no further. This ain't lust. I know this is love. But if I tell the world, I never say enough, 'cause it was not said to you, and that's exactly what I need to do. If I end up with you, should I give up, or should I just keep chasing pavements, even if it leads nowhere? keep chasing pavements even if it leads nowhere. Oh, would it be waste even if I knew my place? Should I leave it there? Should I give up? Or should I just keep on chasing pavements? Should I just keep on chasing pavements? Oh, should I give up? Or should I just keep chasing pavements? Even if it leads nowhere, I wouldn't be a waste. Even if I knew my place, should I leave it there? Should I give up? Or should I just keep chasing pavements? Even if it leads nowhere, yeah.
Wow!
Oh, kanta partner. Sige. Favorite song ni mo ni partner. Sige, sampuli mi gamay partner.
Should I give up
Huh?
or should I just keep chasing pavements even if it leads nowhere?
May nanalo na.
Bitaw, partner.
Partner, sunod partner, ikaw atong guest sa Share to Inspire partner. ha?
Dapat appeal po ka, no? Dapat imo kay sayo po imo partner. O radio drama partner.
Ano lagi ko partner nga, sunod nga Share to Inspire, magsayaw ako, si Sir Norwin, si Ma'am Isabel, ug si Ma'am Maris nga si
Ala,
Don.
excited ko ana, no? Pwede mag-request og inyong sayawan.
Mag-water with the partner.
Ay, pwede partner.
Yes. Partner, dito ta sa to ang synthesis karon nga.
Ay, before ta mag-synthesis partner.
Ay, aduna ta
ato
daghang
i-greet
greetings. Yes.
sana, di na ako makita. Gabi na kay Loretta Soldin Layan. Ano man ang sa taas ni Ma'am Loretta?
Jerilyn Gascon.
Yes, and si Aldeline Saan man ni?
Ay.
Okay.
Mark Jimenez Borja.
Dimpo Hope M. Dulfo.
Yes. Partner, go-watch gyapon ang Dean sa College of Technology, Dr. Marilu Espina. Good morning, ma'am.
Wow. Yes, and Aldine John. Yes, sa tanan mga nagtuto karon sa atong
And of
Facebook
course,
Live.
partner, ang Dean sa College of Law nato partner. No, si Attorney Perpy. Hi, Attorney. And
Yes, Ate Perps, good morning. And of
Yes,
course, no,
partner.
sa tanan na nakatuto karon nga level 3 nursing students karon sa atong research building sa 4th floor. Kauban gyapon si Miss Maurice Rochelle Canonigo Sedon.
Yes. And partners, atong synthesis for this morning, partner, no. I learned one thing, partner. We've been talking a lot about mental health in Share to Heal, pero this is, I guess, the first time I heard it from an expert na nag-ingon siya nga. The role of the parents is very important because in the formative years of in the formative years of the children, for example, in the first 2 years, muna siya ang time nga ga-build siya og trust, no? Muna siya ang years that would actually help the children when he or she grows up, no? Maka-build up siya sa yahang coping mechanism. No, importante kayo din na siya, partner, especially for our first-time parents din, ha, no? Kailangan gyud nga ma-build nato ang coping mechanism or ang trust sa bata, no? Kay it will be very helpful sa yahang pagdako. Partner, nakaimuhang piece nga imo i-share?
Ako pod partner, no, 'di ba, gi-mention ganina ni Ma'am Dolores nga dapat ta maminaw, no, kung nay mag-share sa atua sa ilahang mga pinagdadaanan, dapat nato sila paminaw. And of course, kita pod kung naapod tay na gibati, no, dapat pod nato i-share sa uban. And of course, dapat lang pod katong atong gistoryahan, no, dapat ato pod tong dapat matrust punto nato sila, partner. Yes. No, importante gid kay na ang atong ma-sharean is ato pod someone that we can trust, partner.
Yes, exactly, partner.
So yes, partner, no? Thank you so much, partner Cha, sa imong paghatag sa atong synthesis this morning. So once again, no, kami sa BukSU and this extension project, mapasalamaton sa inyong paghuman og tan-aw sa atong programa. At ang next Wednesday, ang laing episode nga ginahulatan o ginatutukan wala na lain pa no ang pag-ambitay daw ag kaulian. Share to Heal Season 3 goes blended.
Yes, we would like to acknowledge the following. LGU Malaybalay, headed by Honorable J. Warren Pabiliaran. 2nd Congressional District of Bukidnon, headed by Attorney Jonathan Keith T. Flores. Our Smart University President, Dr. Joy M. Mirasol. Vice President for Research Extension and Innovations, Dr. Karina Joan V. Barroso. Our Dimension Leader for today, Attorney Ofelia Pilar Rubio Zamora, the College of Law Dean. All the technical working committees and the whole team of Pag-ambitay daw ag kaulian Share to Heal Season 3 goes blended. Ako si Chaseur Ontolan from the College of Arts and Sciences Language and Letters Department.
Yes, hangtod sa sunod na sa nga higayon mga higala. This is Love Mayhem.
Atong hinumduman partner sa pag-ambitay
o paghiusa kalambuan makabuta.